you want to fend off a virus, there's a natural way to start by boosting your immune system. Dr. Kristi Clark, President and CEO of HealthTexas, is on the line to give us some important pointers during this time of uncertainty. What can folks do to lower their risk of contracting COVID-19?
It's really important this time to listen to our local leaders and make sure that we're all following the instructions they've given us. But from a medical professional standpoint, from a physician standpoint, basically you can think of basically 3 or 4 main things we can do. Number one, crowds. You need to avoid crowds, especially if you're sick. We know that the coronavirus can travel about 6 feet, we think. So it's very important to maintain social distancing. Hand washing. I think there's a lot of concern these days because, I can't find hand sanitizer, this running out of hand sanitizer. Soap and water, plain old soap and water is so important for this. You need to wash thoroughly and wash frequently. Most people will say when you wash your hands, sing the song Happy Birthday twice. Regularly clean surfaces. We know that the coronavirus can live on surfaces now for several hours and many types of surfaces several days. So use disinfectant wipes, keep your phones, iPads, stairwells, banisters, handles, anything you're touching, keep that really clean. Don't touch your face because the virus can also travel through mucous membranes. So make sure you're not touching your face. It can also travel in that way. And most importantly, stay calm. Don't post irresponsibly on social media. Make sure that you are just listening to the guidelines that everyone gives and do exactly what we're all saying overall. And just stay calm. We're going to get through this as a community because we're an amazing community.
What are some other things we can do naturally to boost our immune systems and lower our risk?
Sure. So at this point in the crisis, it's probably not super easy to just boost your immune system right then and now. But in general, there are a lot of ways we can boost our immune system in general. Lean protein. So antibodies are the actual white cells that fight infection. So those are built by protein. So the more lean protein that you're eating, the stronger your antibodies will be and the stronger your response to all kinds of infections, not just coronavirus, but all kinds of infections. Plenty of fruits and vegetables. That gives you vitamins like vitamin A, C, and E. Minerals. Zinc is known to try to help boost our immune system as too. If you don't get enough fresh fruits and vegetables, then you should also take a multivitamin. Talk to your physician about taking a multivitamin if you should. Cook with healthy oils, canola oil, olive oil. These have omega-3s, less omega-6, omega-3 good, omega-6 bad, and you should cook with those. Exercise is really important, and don't smoke. Those are some of the things we can always do to boost our immune system.
So, doctor, if someone is feeling sick and not sure if it's the flu or COVID-19, what should they do?
I think that's the most common question people have right now, Fiona, is, these days, any little cough we get or a sniffle, we automatically think, oh gosh, I wonder if I've been exposed or I have coronavirus. Previously, before this crisis, we would all just go and book an appointment with our doctor and go in and see them. That is not what you should do. Okay, right now, it's really important to try to keep our healthcare providers safe. It's important to preserve the protective equipment that we have. So I would urge everyone, if you are concerned you have flu or COVID, call your physician. And the reasons for that is most physician offices across the city have now set up different protocols. They probably won't see you in their office unless they think you're truly sick or might need testing, but they are going to have telephone visits. A lot of our doctors here at HealthTexas, we've been doing telephone visits the whole week. If for some reason, and your doctor can direct you, if they feel that you're someone who might have COVID symptoms, and they can direct you then to where you could be tested. If they can test you at their office, they will tell you how to do that. If they can send you elsewhere for testing, they'll tell you how to do that. If you don't have a doctor, then you should call the Metropolitan Health District, 210-207-5779, if you don't have a primary care doctor.
Primary care physicians are, of course, your first line of defense, and because they know you and your medical history, HealthTexas primary care doctors are ready to help at several locations around town. You can give them a call at 210-731-HTMG. That's 210-731-4864, or visit their website, healthtexas.org. Dr. Clark, thank you so much for this important information.